This is the part 2 of my previous video. So I'll start off by talking about social anxiety or social phobia, which is what a lot of times people can also refer to their anxiety as. So many people experience this from day to day. It's something that, we kind of can go through and we know that we have it, but we don't always know what we can call it. But we routinely talk with other people about it. So it's like in the vernacular. Social anxiety, it's something that's present. It's kind of defined as being in the present of or the anticipation of others when you think that you might be scrutinized by others. That's something that I think everybody or several people in your friend groups or your family might experience. It's everywhere. It's a part of just being human. So, being able to navigate through your life and being able to deal with that is something that if you can do that and do it a little bit better than maybe what you've been able to do that in the past, you could live a much easier life from day to day, week to week. So when you think about being scrutinized, that's everywhere. So when you're scrutinized, you're probably going to be you're probably going to show that in how you are displaying yourself, unless you're highly regulative in your body language, your facial expressions. So basically, the symptoms that you're displaying. So to give perspective, when you present that to a therapist or a mental health practitioner, they're going to have some context in time period and symptoms or symptomology to basically be able to diagnose you with that. So there's diagnostic criteria, so a set of symptoms, also within a set time frame. So that's social anxiety. Some other things that we can talk about in terms of what fits under the anxiety area is OCD, obsessive compulsive disorder. So obsessions and compulsions. A lot of times people have obsessions and then they have the compulsions. The obsession is the thought and the compulsion is the behavior. So you put those together, you have OCD. Everybody thinks everybody is obsessive and compulsive, obsessive compulsive. That's not always the case. So to be accurately given this diagnosis, you have to be assessed. Most people think that it's just centered around being organized or being clean. That's not always the case either. It can also be like a mentality. And when I say a mentality, it can also be just kind of the way that you think about things. You're kind of you overthink things about how things could be. It's easy to kind of get wrapped up into that, So it's not just the actual behavior in itself of, oh, I need this clean, so I've got to clean it. It takes more than the explanation that I'm going to give right now. So it's a deep on the diagnosis. The next thing is panic disorder that I'll discuss. Panic disorder, I'll describe it as recurrent, unexpected panic attacks. Panic attack is an abrupt surge or intense fear or intense discomfort that reaches a peak within minutes. So, a panic attack versus what you'll also hear is an anxiety attack. An anxiety attack differs in that anxiety is something that you kind of suffer with and you think about over time. So you may be 10-minute, 30-minute time frame. You're thinking about something, and so it's a building effect, and then it just kind of progressively comes upon you, and so the symptoms are very similar to that of a panic attack. Panic attack, you may be experiencing just in a quick minute. So you're hitting this wall of panic in a very short period of time. So you may not be thinking about whatever it is for an extended period of time, but it's just that you've had the thought of it in a very short period of time, and then it just hits right in a very short period of time, and you have the same symptoms. So next thing is agoraphobia. Agoraphobia is a marked fear of or anxiety. The individual may fear or avoid these situations because of thoughts that you may not be able to escape, or that it may be difficult for you to do that. So this is relatively difficult to deal with for a lot of people, because that's just kind of how you get ready to, you're preparing to go somewhere. You're kind of like, I can't do this. So they talk about the central feature for this being a marked or intense fear of anxiety being triggered by the real or anticipated exposure to a wide range of situations. So how broad is that? So most of what people experience with anxiety, if they were being evaluated, they could be diagnosed with generalized anxiety disorder. So this would be considered the excessive worry that is difficult to control, or for an individual who has this. They most often would be diagnosed with this, usually in addition to another diagnosis. So you might also have depression and something else, a mood disorder. So this is usually just excessive worry or tension about something else. You usually will have an unrealistic view of most problems, muscle tension, things like that, probably in most parts of your body. Several other symptoms that are not limited to the ones that I'm discussing. And so again, all of these have to meet specific criteria within a specific time frame. So just the ones that I've mentioned, this is a very, very brief overview. So there's much more to it than what I've given. Other diagnoses that fall within the anxiety realm: body dysmorphic disorder, hoarding disorder, trichotillomania, that's hair pulling, excoriation, or skin picking. These are going to all be centered around anxiety. So there are other diagnoses that were previously included in anxiety, but because they were so significant in their own right, they, in the newest version of the DSM, the diagnostic manual, they pulled them out and had them listed as their own. So, because they needed to kind of reside on their own. So that's very important to know, because they're still very much centered around anxiety, but it's kind of a lot in itself. So all of these you need to be evaluated by your own therapist, your own medical doctor. So this is just basic information. So you need to also consider that, be evaluated by a mental health professional. All right, so if you would subscribe to my channel, give me a like. If you have any comments, give me that comment, and I'll be glad to answer any questions. All right, thanks.